Welcome to USA Global TV and Radio, where our mission is to provide education, entertainment, hope, and inspiration. USA Global TV and Radio connects you with experts and audiences all around the world every single day to help you succeed in business and to live a richer life. Visit us at usaglobaltv.com to learn about career and life-changing training and mentoring programs like the Listening Mentor. Subscribe to our newsletter to stay informed about our special programs and offers. Discover how you can become a guest on one of our shows or a host or producer of a USA Global TV and Radio show of your very own. That's USA Global TV and Radio, where the doctor is always in.
Howdy, red.olaughlin here on Talking Heads on the USA Global TV and Radio Network. This is a 6-part series on cancer that, as of today, is a 7-part series. And rather than trying to cram everything into the last 30 minutes and accomplish what I want to accomplish with this particular presentation, I felt it was best just to go ahead and let's get the details out of the topics I'm going to cover today, and then wrap everything up next week with the things that I really and truly, I believe, are probably going to be the best of the entire 7 parts. So with that, let me go ahead and get the slides loaded up. There's slide 1. Get things straight. Okay. Introduction. Disclaimer. I am not a medical doctor, never been in the medical field, never been in the pharmaceutical field. I'm a researcher. I research the human body at the cellular level, chemically speaking. I look for cause and effect relationships. Treat a cause, fix a problem. Treat a symptom, and you'll always be treating symptoms. I fell in love with chemistry in sophomore high school, and I love it. It's just one of those things that just sticks with me. I was never able to practice chemistry as a chemist because I got an invitation to Vietnam, and things changed after that. However, in the last 7-8 years, in the process of dealing with some other health issues in the family, I started doing some research into what causes things to happen. And I found my love of chemistry just creeping back up on me. And that's what I do now. I really and truly have a passion for diving into those words that are this long, and it doesn't seem like you can pronounce them, but there's just so many things in there. And it's one of those things I really and truly love. So let's go ahead and bump into the next one. We've been talking about cancer, and there's essentially 2 theories. If you talk to a doctor, there's only one genetic mutation. But there's a metabolic respiration theory that's been around for probably 100 years, just about. And we're going to go a lot more to that next week as things happen. But right now, when we look at anything dealing with cancer, it's going to be the genetic model, chemo, radiation, that kind of thing. That's the standard of care. That is what everybody says. If I'm going to do something, it's going to be start out with those kinds of things. And so most of my talking has been generally in that area. Next week, I'm going to talk about how do you treat the metabolic issue. If my standard of care for genetic mutation says that, well, let's say stage 4 pancreatic cancer has a 4% survival rate in 5 years, why does metabolic treatment give you a much higher survival rate in 5 or 10 years? Well, there's things, and we're going to talk about that next week. So standard of care is a major part of that. We'll touch on that a little bit today. This whole series that I'm doing is for awareness, provide information, provide education, so that you can make an informed choice at your next doctor's visit. You can say, Doc, I heard about this or I read about this. What do you think? Go to Google, YouTube, TED Talks, research some Nobel Prizes. If you or somebody in your family has cancer, there's a lot of stuff out there you can go find and talk to your doctor about it. We'll talk a little bit further on that as we get through here today. So my primary focus today is diagnosis, treatment options, and prevention. We're going to get through diagnosis. We're going to just touch on the very front end of treatment and then finish that up next week. Prevention is going to be 1 or 2 slides. It's really a lot easier to prevent it than it is to treat it. So we'll talk about that. Obviously, anytime you want to diagnose something, you want to be able to catch it as early as possible. Yet, if you have a tumor starting, even if you knew where it was, chances are the equipment that's out there can't detect it. You're going to have to let it grow a little bit. And when it grows a little bit, now if you had an idea where it was and you use the right equipment, you might be able to detect it. Typically, our immune system, if there's a foreign invader, it's going to identify it and do something. However, our immune system is finely tuned to the fungus and bacteria and a virus. Those kinds of structural things are way different than our cells and our organs and our tissues. But a normal cell, when it mutates, can hide from our immune system because it just sort of masks it for a number of different ways. And so we look at what kind of things that we can do to test for. Well, somebody might think, well, if I have a gene for, say, breast cancer, I have a gene for colorectal cancer, I have a gene for whatever. Genetically speaking, that gene is probably only going to be about 5% effective. And epigenetically, that's our lifestyle. These are the things that we do, our exercise, our stress management, our diet, those kinds of things we do on an everyday basis can turn on that gene or turn off that gene, just like a light switch. So, but in the big scheme of things, genes are not really a major problem, but they can be in 1 out of 20 cases. One blood test does not diagnose all cancers. Yeah, you might be able to say, yeah, I have leukemia, but it may not necessarily diagnose a brain cancer, for instance. But blood tests will tell us a lot about things. It'll tell us about the metabolites that we have, the electrolytes, what their status are, proteins that are there, fats, sugars, enzymes. It'll tell us a lot, but it won't tell us that we have cancer if it's just the annual blood test. And so that's how these cancers develop. They get big enough that had we do some kind of X-ray or scan, we might be able to detect them, but there's nothing there to tell us to go look somewhere else. They tell us how healthy our organs are, our liver, our kidneys, and everything else, but they don't necessarily tell us how unhealthy they are without some of the other kinds of tests. So you have to have something out there that's going to tell you just beyond a simple blood test. And we're going to get into symptoms here shortly, but realistically, you can have cancer, have something the size of a baseball, and never have any symptoms until it's literally too late. But there are other kind of tests besides blood tests. There's a cytogenetic test. This looks specifically at what's changing in your chromosomes. If you have a mutation in the chromosomes, that's probably where you're going to find something. The immunophenotyping. When you have something present that's not supposed to be there, its antigens are present in that particular, the surface of that particular molecule. So if you have a tumor, we talked about here with the COVID, there's antigens that are present that allow us to detect that COVID virus. Well, we have the same thing with the cancers. There's antigens there, but you have to look at what is actually producing an antigen in order to say, oh, that might be a cancer. Let's go take a closer look. If you take a closer look, maybe a liquid biopsy, you're looking at specific pieces of DNA that's in your bloodstream. Maybe something broke off, got into the bloodstream. You can do a biopsy on it, take a blood sample, and it might appear there, it might not, but it's another way of looking at things. Spectrum cytology. Well, in this particular one, you're looking at your spit. And if there's abnormal cells in your sputum, then that's another way of saying, hey, you might have a cancer. Tumor marker. This is a big deal because there are just like biomarkers for health, biomarkers for other kinds of disease, heart disease, other things. Biomarkers show up if there's a cancer present, but you got to look at where that's at. So there's an issue with, I'd like to get my biomarkers looking at that. But if you don't know you have something, they don't typically go look there. Now, if you have something that indicates a problem, a tumor marker is probably a very good one to do, and it's going to link in later on to your immune system. Your analysis, again, you're looking at sugar proteins and what damage, if any, or how many white blood cells you have. If your immune system is starting to do something, that's maybe a good place to show up where the body's responding, but you don't have any other symptoms yet. You go back one. Yeah, let me go back one. Okay, too many. MRI. When you want to know something detailed, an MRI might be the right instrument to use. Sometimes you use an X-ray, sometimes you use a CT scan. They're going to give you different images of the same part of the body. If you have soft tissue, you're not going to get the same clarity. Maybe with a CT scan, you might have some kind of dye that's mixed in it. Maybe the same thing with an MRI. It might be a nuclear dye. It might be something else with a positron, the PET scan. That's going to detect more of the metabolism that's in the tissues rather than something that a CT scan is going to be looking at. So the PET scan, again, is a positron emission tomography is what it is, but it deals with more of the metabolism. But that's an nuclear sugar, if I remember right. And it's going to give you a different perspective. And sometimes they'll do a PET scan after you had radiation and chemotherapy to see, okay, we did a PET scan before you start all this, let's do a PET scan afterwards. And they're looking at before and after. A nuclear scan, same kind of thing as a PET scan and maybe a CT scan, but they're looking at where is the radiation actually absorbed into the tissues and the organs. If you have a healthy liver, you're going to get a certain amount of radiation that's absorbed into that liver. But if you have a cancer in there, it's going to show up differently because that cancer tumor is going to have a different level of absorption. So it gives you a different view. Bone scans, again, another view of something that's out there that's going to help them isolate. Okay, I think you might have a cancer. It's all indications, but where is it at? Ultrasound, again, another way of looking at parts of the body. Ultrasounds are used for a lot of different things, pregnancy, for the heart, just innumerable things that ultrasound gives you a live picture of what's going on right now. We talked briefly about X-rays. Again, each one of these things in and of itself might isolate the individual problem, but it's all going to be used in conjunction with something else. You may start out with a blood test. You may end up with a PET scan. You may end up with an ultrasound. You may end up with a biopsy. You may just jump right straight into a biopsy because the PET scan found something. So it's up to the doctor to say, okay, this is what we're going to do next. But these things are all available out there for the doctor to use. But a biopsy, you're basically pulling out a part of the body and saying, there it is, and you know something about it. Your annual blood work, chances of it uncovering something, not great. However, I end up getting extra blood tests done each year, or if I don't get it done with my annual exam, I go out and I pay a laboratory to have it done. One of the ones I've been relying on for years is called the C-reactive protein. It reacts to inflammation in the body. If your body has nothing in there that's a problem, it's going to be very, very close to zero. If it starts to have a problem with inflammation, it's going to start registering a number. Generally speaking, if my wife and I had the same level of say, inflammation in the body, hers is probably going to be slightly higher. For women, if let's say mine's a 0.3, she might be a 0.35. It's going to be just slightly higher because of fat tissue and other things that are more predominant in the structure of the female anatomy than in the male anatomy. But again, can she be less than me? Absolutely. She has been in the past less than me. But it's something that we get done every year, the two of us. But CRP to me, I think, is one of the most telling of all blood tests. It's very inexpensive. It's super easy to do. But why they don't include that in normal blood tests, I have no idea in the world. It boggles my mind how much information you can get from one blood test. But it's the body's response to inflammation. Obviously, if the bottom end is zero and it's zero, do I have a problem? Yeah, there are cases where you might have lupus and the CRP is being pulled into the lupus process. But in reality, if you have zero, chances are you don't have anything to worry about. But if you have high levels, and what is high? Depending on how it's being measured. You see my next slide, I think, covers that one. No, I think the previous one, I called it 0 to 1 milligrams per deciliter is the range. But if you have a 4, a 5, a 20, a 30, the higher the number, the more concern you should have. Now, does that mean you have cancer? No. Does that mean you have something? Something is generating inflammation in the body. It could be any number of things. You'd be amazed at how many things out there generates inflammation in the body. Heart disease, very much so. But you can also get what's called a homocysteine level check. It's another blood test. I get it done on my annual physicals. And it used to be the gold standard for heart disease. And when the heart is operating fine, you have a certain response to homocysteine. When it's outside that range, below or high, then you have a problem. Metabolic syndrome, again, you see that typically with your belly hanging over your weight, your belt, high blood pressure, high cholesterol, things like that. They jump in, kind of just all push it into the generic term metabolic syndrome. Probably a predecessor for diabetes. Obesity, again, if you have a lot of fat, you're going to have a lot of high levels of inflammation in the body. Stroke, again, inflammation. Sleep apnea, well, they sleep problems are going to increase a risk of a lot of things, but sleep apnea is a very deadly disease. You can go to sleep at night and never wake up. And again, because of the inflammation it generates, it's a major problem. Rheumatoid arthritis, gum disease, inflammatory bowel disease, fatigue, depression, all of these things increase the level of inflammation in the body. If you have a little bit of vision loss, dementia, cancer, or even just the risk of cancer, the mere fact that you have increased levels of inflammation in the body gives you a step ahead in maybe developing a cancer in some place in the body. So that to me is the true value of that CRP, because it just indicates so many things. Now, high levels also indicate, I mentioned earlier, sleep problems, smoking, stress. Stress being the genesis of 80-90% of every doctor's visit. If you control your stress, you probably control literally the entire health that you'll ever have in your entire lifetime. There are a couple other things we'll talk about too, but stress is one of those ones that most of us never do anything about, but every day we have it. Socioeconomic conditions. If you're poor, you're living in poverty, you don't have access to a lot of things, doctors, medical care, chances are you're not eating properly, you're not exercising. There's just a lot of things that when socioeconomic conditions are there, your CRP is going to be higher. They've done a lot of tests on that, and it's generally true. Substance abuse. I thought the next two were kind of interesting. Altitude. At altitude, your body has a tendency to become a little bit more inflamed. That actually is measurable. Some people with extreme cold can have that inflammatory response. Dietary fats, probably one of the biggest areas. If you're eating primarily vegetable fats, a little bit of them, fine. You want to try to keep your omega-6, your vegetable fats, and your omega-3, your fatty acid, your fish fats, about equal, 1-to-1 ratio. That's the best you can have. You get outside of that range of 4-to-1 vegetable fat to fish oil. Now you start getting into a situation where that vegetable oil, the canola oil, the sunflower, all that stuff now becomes highly inflammatory in the body. That inflammation will be registered on a CRP test. Vitamin deficiency, high leptin. Leptin is a result of your hunger. Your hunger may be linked to your levels of fat in the body, obesity. So high leptin levels might also generate higher levels of CRP. High estrogen does the same. If your body is fighting something, your immune system is actively attacking something, you're going to have higher levels of cytokines. All these things are going to increase the level of CRP. So just because you have a 4.2 on your CRP doesn't mean it's cancer, but it means you have inflammation. And there's just a myriad of things that can be done to say, well, maybe I need to change my diet. Maybe I need to change other things. So how do you address that? How do I lower my CRP? Well, obviously the best way is what's causing it. That's up to you and your doctor to try to figure that out. If exercise works well, losing weight if you're overweight, if you have nutrient deficiencies, hormonal deficiencies, a balanced diet will bring that back into alignment. Alcohol in moderation, no smoking, cut back on that immensely. Stress management, again, stress is the genesis of so many things. If you're depressed, anxiety, also linked many times to a vitamin deficiency. Optimism can change that. So you're looking at your mindset to change your body, your subconscious mind. Maybe coffee and green tea have been known to kind of tone down the level of inflammation in the body. If you're in that low range, say below 1, and you have concerns, maybe there's issues there, there's another test called highly sensitive, HSCRP. And that gets into that lower end of things, that below the 1.0. You could have everything looks good, I'm at a 0.7. But if you had a highly sensitive CRP, it might be something that really hones in on a part of the body. So if you're not thinking well, you're not doing well, might be best to just, say, doc, maybe I need a highly sensitive CRP to help figure that one out. If I'm looking at diagnosing, what's causing me to get a diagnosis? So let's assume right now that I might have cancer, right? And many of us probably do. Maybe our immune system's keeping it under control. Maybe it's just, and it's interesting too that, let's say that I catch it and I'm at age 30 and I have it removed. Boom, I live to my expected life expectancy, say 78 degrees. Okay, fine, I got rid of that. But what if I had a diagnosis and I'm, say, 65? Can I still live to 78? Probably. But we want to not necessarily catch it at the last moment. We want to catch it as soon as we can. So what things are we looking for when we say, okay, I have something, doc, I really need to, I'm concerned. Cancer runs in my family, whatever it may happen to be. But if you have long periods, something that's abnormal, a pelvic pain, changes in your bathroom habits, bloating, breast changes, a lot of issues with that, with the external and internal on the breast. My wife had this thing you could feel. Yeah, there's something there, but 10 minutes later you couldn't feel it. Well, I'm pretty sure I felt something, but it's not there. Okay, we'll try again tomorrow or later. And this went back and on for several months. That okay, we definitely know it's something, but it's not there 10 minutes later. And so it's one of those things that, you need to constantly check for parts of your body that are subject to that. Chronic coughing, chronic headaches, difficulty swallowing. Real good friend of mine passed away not long ago. He had difficulty even after about 3 months swallowing water. And the cancer that he had could have been identified very early because he had this difficulty swallowing, but it was one of those things, it's going to get better, it's going to get better, it's going to get better. I don't know if he waited too long. I don't know what the issue was, but it was just one of those things that it was, don't think about this, but I had difficulty swallowing. Excessive bruising, frequent fevers or infections, changes in your mouth, your gums and things, persistent pain, postmenopausal bleeding, stomach pain, nausea. Now, it's kind of one that you combine that with maybe weight loss or some unusual lump someplace. Now you have 2 or 3 things going on. If you take a look at the symptoms, say, for pancreatic cancer, and it says, okay, I'm going to have jaundiced eyes, I'm going to have jaundiced skin, I'm going to have stomach pain, I'm going to have unexplained weight loss. Lost my brother-in-law not that long ago, less than a year ago, to pancreatic cancer. And he lost a lot of weight very, very quickly. You go to the doctor and they say, oh, I see you lost 10 pounds since the last time you were in here a year ago. Is that something that happened that you did, or is it something that's happened to you? They're very concerned if you have a significant weight loss in a short period of time. You can easily have stage 4 cancer where it's metastasizing into other parts of the body and literally have no symptoms. So something to be really and truly aware of. We could almost do a 30-minute show totally on home tests. There are home tests for all sorts of things. I'm sure quite a few of you have done the home test for COVID. There's a home test for Alzheimer's, the APOE4 gene. And just because you have it doesn't mean you're going to get it. But there are home tests. Just type into Google. That should be home test. How to test cancer at home. And I pulled up on Amazon so many specific tests. It's unbelievable. You can test for colorectal cancer. My wife and I have been doing the Cologuard test every year up until about age 75, a year or 2 back. And doctor says after 75, you don't need that test anymore. But it's one that looks for occult blood in the stool. And so that's a very simple one to do at home. But there are a lot of tests that you can do at home for various parts of the body, urine, spit, blood, whatever it may happen to be. You can take some of these things down at your local laboratory and get other tests done. Okay, fine. You're going to spend $25 to $100 having a test, but it might be a test that, okay, I had that test done, doc. It came back with this number. I really need to talk to you about it. But before you do anything, before you take a home test, talk to your doctor. I mean, that's the resident expert. It's a double-edged sword with the doctor. He or she has the obligation, legal and moral obligation. If they find something wrong with you, they have to treat you. Now, if you go in there and you have, say, high blood pressure, and you say, doc, I'm a little bit overweight, let me lose some weight. You say, okay, fine, let's check you back again in 3 months. Or you say, doc, I really need to exercise more. I know in the past I've controlled high blood pressure with exercising. So, okay, doc, give you 3 months. Let's go do your exercise. You have a lot of leeway, but talk to your doctor, because he or she has the obligation to say, okay, I want you on this pill. I want you to take these tests or whatever. But sometimes you can say, I'd like to do this first. And they're pretty good about that if you have a legitimate reason why. Standard of care, we talked about that at the very first session. This is the treatment that's accepted by our medical experts. It's widely used by healthcare professionals all over the United States, all over the world, for certain kinds of diseases. For cancer, we're talking about cancer and radiation kinds of things. Many places it's called best practices. They have other words for it too. And just because it's a standard of care in the United States doesn't make it the standard of care in India, in China, in any part of Europe or Ukraine, Egypt, Turkey, because I'll be talking about Turkey and Egypt here next week. But sometimes we have biomarker testing. That's part of a treatment. Okay, we know that this thing's here, and if I can put something in the body, or I ask for a certain test that's going to give me the results of that biomarker, then treatment can be identified specifically for that kind of test. Chemotherapy, kind of the standard. Everybody jumps on it. Sometimes very, very successful, especially if it's stage 1, very early on, you have cancer. There's no indication it's gone to the lymph nodes. Chemotherapy might be a very good, may not even be needed. Might be a pill, might be an injection into the bloodstream. Hormonal therapy, again, another option. Hyperthermia, that is one where they actually give you ingest a substance to die, and then they hit you with a light that brings that particular organ or tissue up to high temperature that the cancer cannot survive. So basically, you're burning away, melting away the cancer. Immunotherapy, that seems to be the latest. When I'm looking at the last 10 years, 20 years so of TED Talks, looking at Nobel Prizes, looking at things of where is our cancer treatment going. Immunotherapy seems to be one of the better ones. And I'll be talking a lot more about that next week, because there's some things in immunotherapy that's not even being used in the immunotherapy that's going on right now. But that's where we're using our immune system to target the cancer cells. They can't see them, but if we can hang a little tag on the outside of that cancer cell, now all of a sudden the immune system can see it. Photodynamic theory, again, another way of using light. Radiation therapy, very common. Stem cell transplants. I'll get a little bit more into that next week, not a whole lot more, but a little bit more of, well, if I can use stem cells, how can I get my own stem cells to increase? As we get older, we make less and less, but there are things we can do. Obviously, surgery is a standard of care. There's a thing called targeted therapy, where you're really and truly targeting the immune system to get into a particular area of a tissue or an organ. And the targeted therapy can be very effective. Again, with any kind of treatment, you're going to have side effects: fatigue, loss of appetite, weight loss, malnutrition. This can be a big one, particularly if you're in a fasting mode to counter. We'll talk more about this next week. But if fasting is one of the options you're going to choose to help fight cancer, you got to really maintain your nutrition as best you can. you have weight loss, but you also have weight gain. A lot of that may be fluid retention, nausea, vomiting, diarrhea. Sometimes you eat and all of a sudden you're full. Sometimes you don't even want to eat because something tastes different. It tastes funny. You may have enjoyed milk or ice cream, and all of a sudden you're milk or lactose intolerant. It doesn't taste good anymore. Food aversion. You don't want to go there. Sore mouth, tongue, throat. Might have dry mouth. A lot of things with the mouth, like we talked about your spit earlier as an indicator of something. A lot of things shows up there. Difficulty swallowing, tooth decay, stricture. That's when your throat, your esophagus kind of constricts a lot and doesn't allow food or anything down. That can be a side effect of some of the drugs that are out there. Trouble remembering things, hair loss, very, very typical with a lot of chemotherapy. What do I recommend? Personal stories on cancer cure, management, remission. Just go to YouTube. There are more there than you know what to do with. Some, it happened. Some my subconscious mind helped me overcome it. Some, well, I did this non-approved method and it worked. Another one, I went to Mexico, did this, it worked. It doesn't matter. Knowing what's out there makes your visit to the doctor a much more to and fro, not just one side he's giving you all the information. You're at least having a conversation. Google non-toxic cancer treatments. Methylene blue is one of those things I loved back when I was a chemistry major. It's a blue crystal, and if you sneak it into somebody's cookie or something like that, it makes you urinate bright blue, and it's kind of fun at parties. But it's also a care that can be done for some kinds of cancer. So it's a non-toxic cancer treatment. So Google non-standard cancer treatments. Again, you're becoming aware of things, increasing your education. It just increases your ability to talk to your doctor and understand what is the big picture out there and what can I do. Other things we're going to be talking about next week: metabolic disease versus the genetic. I'm going to be more on the metabolic side next week. Our metabolic end of things, we're looking at the two main food sources for cancers to grow: glucose and glutamine. Go in a lot of detail about that next week. Mentioned fasting or starvation earlier, stem cells, nutrition, fecal cell transplant. You're actually taking poop from somebody and transplanting it to somebody else. Again, kind of a messy story, but we'll talk a little bit about it. I should have had something up there on mushrooms. I missed that one, but our subconscious mind will touch on that. So next week, we're going to be getting really into the heart and the matter of everything dealing with what are some of the things that are just not the normal treatments, but are effective, probably even better effective than the standard of care. But again, this is educational purposes. I'm telling you what's out there. You really need to talk to your doctor. I have some books that's available right now, available on my website or on Amazon. No matter what you can do, it talks about your subconscious mind, a lot of ways to help yourself there. The Joys of Ageless Health talks about disease, what causes it, what can you do about it. Longevity Secrets for Healthy Aging talks about the two primary causes of aging and what you can do to accelerate or decelerate the aging process. And my latest book out 2 months ago, Understanding the Causes of Alzheimer's, and what options you might have there too. So those are the things that I have to share with you today. I appreciate you being with me. A lot of this information is available on the archives on YouTube, on the USA Global TV and Radio Network. And next week, I'll have my final 7 out of 7 series on cancer, and I look forward to joining you then. Take care.